Intubating a COVID-19 patient or a suspected case is a high-risk procedure. So we have to perform it in a safe way. So to perform it safe, there are three things we have to take care of. We have to minimize the aerosolization that may happen. We have to maximize the first attempt success, and we have to limit the contamination. As all the evidence depends on the expert opinion, so we are running at the cutting edge of the evidence. So to intubate the patient safe, there are two main steps. The first step is the preparation, what will be done outside the patient room, and the second step is the intubation consequence. So the preparation, there are 6 things we have to prepare outside the patient room. The first thing we have to prepare is the pre-oxygenation equipment. There are many ways, but the most 2 common ways are the non-breathing mask and the BVM with viral filter without bagging. So to use the BVM, we have to have the oxygen adapter connected to the oxygen supplement, and we have the flush flow for the BVM. So the oxygen supplement will be around 4 to 6 liters, and the flush will be the maximum, and the beep valve will be around 15 to 20. The mask has to be well sealed on the patient, and it's preferable to be in a negative pressure room if that's available. The second thing we have to prepare our medications. So as there are 3 type of medication we have to prepare. The first medication is our RSI. So we will use the hypnotic agent, whatever is available in your center or hospital. You can use propofol, ketamine, ethimidate, and the muscle relaxant, 6-phenylcholine or rocronium. The most important thing, you have to give high dose to make sure the patient is fully sedated, fully paralyzed, no coughing, no gag during the intubation. The second thing, you will prepare phenylephrine push dose, that if the patient went to hypotension, you have your push dose of the phenylephrine. The third type of medications you prepare is your infusion pumps. You will prepare 4 infusion pumps, be ready to be started. Noradrenaline, your opioid, either fentanyl, most likely fentanyl, and your sedation agent and the muscle relaxant. So those are the medication you have to prepare. The fourth thing you have to prepare is your intubation equipment. Intubation equipment, you will have 2 sets. Your regular intubation set, and you will have also your emergency airway kit also ready. And as you see, these are the list most likely the common things that you will use in your primary kit for the intubation, and the second list is most of the things you will use in your emergency airway. Most important thing, if you have video laryngoscope, the preferable way to intubate is using the video laryngoscope with the bougie. The 5th thing you will prepare is your mechanical ventilator. Has to be connected, has to be ready to be connected to the patient with the inline suction and viral filter connected already. The 6th thing you have to prepare is your PPE. The 5th thing you have to prepare is your PPE. It should be full equipment PPE for all the team, okay? And to have the cube, if that's available, or you can use the plastic bag to cover the patient during the intubation to minimize the aerosolization. The 6th thing that you will prepare is your team. There will be 2 teams: the primary team, which are 3 persons, the airway expert, his assistant, and the clinical support. And the secondary team who will be waiting outside the room in case help is needed is another airway expert and clinical support. So those are the 6 things you have to prepare before entering inside the patient room. So once you enter inside the patient room, you will start the intubation strategy. So you will pre-oxygenate your patient, whatever method you prefer. Then after that, you will give your RSA. After patient is fully sedated, paralyzed, you will use your video laryngoscope with the bougie to intubate the patient, inflate the cuff immediately, connect your ventilator with the CO2 detector. Do not auscultate the patient. How you will confirm the tube is in, it's either 3 ways most likely. First thing you will see, the black line is at the vocal cord. The second thing is by your CO2 detector, and the third thing later on when you do chest X-ray. Now my colleagues will demonstrate it on the mannequin and will show how the intubation will be.
Assalamu alaikum. We are going to intubate one COVID-19 patient. Just now we have to do a preparation, quick. I'm Dr. Khalid, will be the intubator. Dr. Adil will be my assistant, and equipment is ready. Dr. Adil?
Yes, ready.
And Dr. Abdul Fattah will be the clinical support for us. The ventilator is okay.
Okay, everything is okay.
And the second team will be Dr. Anas and Dr. Abdul Rauf. So now we will put our PPE and we will start with the sedation of the patient. Please, Dr. Abdul Fattah, give propofol 200 milligram and flush it, please.
Okay, yes, 200 milligram propofol given and flush.
Thank you. So now give rocuronium 50 milligram and flush.
50 milligram rocuronium given and flushed now.
Thank you. Just suction is ready already. Can you give me the video laryngoscope?
It's ready.
Okay. So already the breathing is stopped. Now we will start to intubate. Dr. Adil, keep the tube ready.
Ready.
Okay. Give me the tube with the skillet and go into the intubation. Okay. Okay. Can you just put the inflate the balloon, please?
Inflated already.
Good. Okay. Fix the tube, please, and connect to the ventilator with calorimeter or CO2 detector.
Okay. Color change already. You are in the.
Good. Can you see the
Equal now.
equal breathing? Okay, we are not using the cystoscope here.
We start with
Okay.
ventilation breathing. We can see equal chest expansion.
Okay, good.
We'll double check with the chest X-ray.
Good. Can you give me 4GP, please?
Okay. Good.
Line.
Okay.
Okay.
Okay, done. So we will fix both, and we will do X-ray to confirm. Make sure that the ventilator setting is on the optimal.
Yeah.
For ventilation,
Okay.
everything.
Okay, we already fixed the tube and the line. Please prepare for central line and arterial line of the Dr. Abdul Fattah.
Okay. Be ready.